I am joined today by Professor Charmaine Gauci. Thank you so much, Professor Gauci, for finding the time in your busy schedule to come and join us here today.
It's a pleasure.
This virus must have changed your life drastically. It's changed everyone's life. But you've been the linchpin in Malta and the person that everyone waits for every morning, the person who gives hope and educates people. Do you find time in your busy schedule today to actually wind down a bit and have time for your family also?
Okay. Thank you, Leah, for this invitation. It's an honor to be invited to this news portal, also to reach out to the people who don't understand the Maltese language, because it's an important message to pass through. It's a whole team behind me who is working on this pandemic. It's a very important issue and a challenge to all of us. It's a whole team who's working, and the team is working on evidence-based information. We're always trying to find out the latest evidence so that we can apply that to our practice. We learn as well from other countries, so whatever we are doing tirelessly in order to be sure that whatever we do it in the right way. And it's always very important that we try and dedicate time to ourselves, but in reality, there's so much to do that we find very little time for ourselves. And that's a challenge as well, yet we know that this is really a long way, so we'll try our best to find some time now and again.
The whole virus, the whole situation has been totally unprecedented, something you probably never foresaw in your professional life. We always hear of the frontliners and the health workers and the doctors, but I also am aware that you've got your own team. Can you perhaps give us a brief outlook on what happens behind the scenes?
Yes, this is very important work, which you have different professionals working along all the way. The public health team, which I lead, is the COVID-19 response team, which looks at the public health aspect of the whole situation and the overall coordination. So there's a long process which looks behind all the scenes whenever we come up with the results of the positive patient. So we have a team which works on the helpline, which is very important, whereby they are there to answer any questions from the public. It's a 111, and for those foreigners who are in Malta who have a foreign telephone number, it's 213244086. There's a good team there who assesses all the questions of the people and relays that to information. And whenever we have people who are symptomatic, then we refer them for testing. So there are the swabbing team, which are there in different centers that we have in Malta and another center in Gozo, whereby people are given an appointment and people go there, have the swab test done, and the advice is provided that people need to go home, rest and stay home until they get the result and until the symptoms go away. There's the samples which go to our laboratory at Malta Day Hospital, so there's another important team there who works tirelessly, almost 24 hours, and working on the samples. And then when we get the results, then we have the response team who looks both at the negative results and informs the people of their negative results and advice on the way forward. And then with the positive cases, we have the case management team who looks at each individual positive case. We make a risk assessment, we look at the clinical aspect, whether they need hospitalization in conjunction with the doctors at Malta Day, and also whether they can stay at home. So in that respect, then we evaluate as well the possible exposure risk. We look also at the contact. So there goes also another team which is responsible for contact tracing. And we try to identify as many people who are in contact so that we can try and close the link. Then we also have another team, which is the discharge team, which looks at the people who have passed through their condition and actually then result in a negative result, whereby then we can discourage them from continuing to go out until they are non-infectious anymore. And then also that team will look at the recoveries, which we are daily announcing as well. Above all this, we have also a data management and IT team, which looks at all the data processes. And then we have also the high-level decision-making, which is a senior management team, which is coordinating everything, and also the senior advisory team, which looks at all the data, all the measures in public health which need to be applied in order to control this pandemic. All this is done in coordination with teams at Mater Dei, in primary care, and also within the private sector. And also even on a higher level, whereby we have coordinated measures with other sectors, because they all play a role. All of the other sectors are affected by these pandemics, so it's very important that we coordinate everything together.
Yes.
And there's also an enforcement team, which looks at the people in isolation, the people in quarantine, and also looking also at the ports and also the airports. Even though they're closed, we still need to monitor those areas as well.
Incredible. It's incredible work, incredible coordination. And you've put, the way you've projected the results, you've actually made them human rather than figures, and I actually really like that, and I know a lot of people do. Do you have a comment on the vaccine trials that are going to commence in the United Kingdom tomorrow?
Yes, that's something which is really long awaited, because the real exit, if we had to talk of an exit from all this, is when we actually have a vaccine, and a vaccine which works, and that people will build the immunity to it. This is very important, because as we are realizing, we are controlling this situation through a number of measures. And the measures aren't really so nice, because we have to do the social distancing, we have unfortunately to close some shops, some people cannot go to work because they are vulnerable, some people have to stay in. So the real exit from this is when we have this vaccine which is available. We are looking forward to the trials which will be commencing in UK tomorrow, and we hope that we will have good results, that people will be building immunity to this virus, because it's a new virus, so we don't have experience with it. So this will be something which will benefit the whole global situation, and which is something which can only stop this pandemic. So looking forward to the results and collaboration with other scientists.
Thank you very much, Professor Gauci, and thank you for passing on the message to the communities that don't speak Maltese too. I wish you a good evening. Thank you very much.
Thank you very much.
Thank you. That was Professor Charmaine Gauci with an update, and I hope a message to all those who don't understand Maltese. I thank her very much. I thank you again for watching. I'm Leah Hogg for Net News. Good night.